Hello, I'm Dr. Michael Ches. I'm a pediatric epileptologist here to talk to you today about deep brain stimulation, or DBS. I'm talking on behalf of the Lennox-Gastaut Foundation today. Next slide. What is it? This is a device that's usually placed through a burr hole as an electrode that's a stimulating electrode into the thalamic or subthalamic nuclei of the brain, deep in the brain, as you can see from that green cartoon model of an electrode going deep into those structures called the thalami or the subthalamic nuclei. And it is a repetitive timed stimulation to the brain, like every 2 minutes, every 3 minutes or so, at a certain current or charge, which is hopefully going to redirect any epileptic discharges or abnormal discharges and synchronize them not to cause seizures. This is a device that's implanted elsewhere in the body with a battery pack and a charge generator. And that generator then has a wire under the scalp, as you can see from this model, that then goes up to the opening where the electrode is sent the stimulation. It can be replaced, the battery, by just doing a small incision in the chest where the stimulator may be. Some people have it in their back, but it's placed peripherally and not in the skull or the brain itself. The only thing sitting in the brain is the stimulating electrode. Usually for deep brain stimulation, it's a bilateral implant on both thalamic or subthalamic nuclei. Rarely it would be unilateral in some conditions. Deep brain stimulation is also used for Parkinson's and sometimes Tourette's syndrome, or rarely obsessive compulsive disorders, also hitting certain deep brain structures, often different than what we use for epilepsy. Next slide. And who is it for? It's for patients who failed medications and do not have a safe or easy location to do epilepsy surgery in a simple resective fashion. They're usually multifocal or very severe generalized type of epilepsies. And it has not been approved for use in Lennox-Gastaut syndrome, but it has been used off-label and with prior devices that do deep brain stimulation in some research in Lennox-Gastaut. So there may be some potential for it in this condition, hitting those deep brain structures. Next slide. Why would you decide to try this? Well, if you failed multiple medications, and most people who've tried this device have failed over 5 to 7 medications, and sometimes other surgeries or a vagal nerve neurostimulator, for example, have been failed. And they do this because they have no other options for epilepsy treatment other than a surgical option. And at this point, resective surgery, which is traditionally removing part of the brain causing epilepsy, would either leave so much damage or that it's not able to find one spot that could be safely removed. Like all neurostimulation, this is a system that's called open loop. There's no electrical monitoring of the brain, or there's nothing telling you what the brain is doing. You're just giving a stimulation every so many minutes for so many seconds at a certain current that hopefully disrupts the epileptic process and sends the way the brain has regional systems that talk to each other. It basically takes that connectivity of those systems and disrupt epileptic propagation is the theory of how it works. And it differs from responsive neurostimulators or RNS in that those are a closed system which both records and then gives a shock every time there's a seizure specifically that the device is able to detect using EEG. This does not do that. This is just automatically giving a charge every so many minutes for so many seconds. It's similar to the vagal nerve stimulator, which also gives a electrical stimulation every so many minutes for, say, 20 to 30 seconds. Traditionally 30 seconds with 3 minutes off for the vagal nerve. The deep brain stimulator has different programming, and it can be set for individuals at different times of both the amplitude of the current, the frequency of the current, the duration of the current, and how many times it goes off. All neurostimulation may take months 6 to 12 months to fully know its full effect. And so it's really something you adjust every few months to try and get to the setting that works best for an individual patient. Next slide, please. What are your concerns about trying this? Well, this is a device that goes into deep brain structures. There's always a small risk of bleeding or injury with surgery. It is invasive, but it does have a limited invasiveness, and that's only a single electrode, and it is reversible. If it doesn't work, you can always take it out. With resective surgery, once you've destroyed or removed part of the brain, you can't put it back in. There is a battery that will need replacing over time, but again, it's in your chest, it's not in your brain, and it's a minor surgery to change the battery. You could get an infection both in your chest where the battery and generator are, or along the track of the device, or into the burr hole or device itself. Those are very rare with surgery, but they can happen, and so you always want to be concerned, risk of bleeding or infection anytime you do surgery like this. And then there's limited data on conditions at this point with Lennox-Gastaut syndrome, but in the future we may have more data with deep brain stimulation. And then when it was initially brought out, they used some of the worst patients who had failed so many different things that their response was strong enough to get approval in Europe, but it had to get more data to get approval here in the United States for, say, partial seizures and secondary generalized seizures who don't have LGS or those type of epileptic encephalopathic syndromes. Now, as we've gained more information about deep brain stimulation, it's looking more effective than those initial trials because more wide range of patients are trying it who maybe aren't as severe and will have a better response to neurostimulation. And we're also learning about some of the patients that are being looked at with Lennox-Gastaut and other things, which may be good groups for this deep brain stimulation that weren't tested as part of those initial trials. Again, it's not approved for Lennox-Gastaut by the FDA at this time. Next slide. So only specialized epilepsy centers are doing this. People who have a lot of experience with different type of options for epilepsy and epilepsy surgery. You can't get it everywhere, but in most major centers it's available. It may not cure, but may only eliminate a portion of the seizures, which still hopefully improves the quality of life. You may still need medications. We talked about some of the negative risks, which are typical of any surgical intervention, and it takes time to work. As I said, it's not going to be immediate, but it's something that works over time, and hopefully in 6 months to a year, you see the benefit. Next slide. To find out more about this and other topics, please visit lgsfoundation.org.